Hello, my name is Elizabeth Williams. This PowerPoint presentation is based on nursing shortage in the hospital setting. This is a strategic plan to prevent nursing shortage. And I hope you enjoy the presentation. So the nursing shortage. The United States is projected to experience a shortage of registered nurses that is expected to intensify as baby boomers age and the need for healthcare grows. So as more baby boomers retire and the healthcare industry requires more nurses to provide patient care, the nursing shortage is going to actually, most hospitals are going to have problems with the nursing shortage. And adding to that, more nursing schools across the country are going to be struggling to help expand or put out more nurses, because of the nursing shortage. It's going to be a greater demand for nurses. And also according to the Bureau of Labor Statistics, which was this employment projection was produced in 2017, and it says basically between 2012 and 2022 there will be a greater demand for nurses. And there's going to be like 525,000 replacements needed for nurses. So the nursing shortage has a great effect on how it affects the nurses that are actually working within the hospital. Okay, so you have high nursing turnovers, in the hospital setting. This causes increased stress for the nurses. It lowers patients' care quality because the nurses may have more patient assignments, so it's going to be more patient to nurse or nurse to patient ratio, and all this can cause the nurses to leave the hospital setting far as being burnt out. And then not only that, it increases job dissatisfaction. Who wants to come to work when you don't have the resources such as extra people to help you provide the best care possible to the patient? And at the end of the day, you're taking care of these patients, you have an increased risk of emotional exhaustion. And here is just a PowerPoint slide that I found, a graph basically, patient to nurse ratio. What happens where nurses are overexhausted and have increased job dissatisfaction. Excuse me. So how can we restructure the hospital setting? Well, you have 4 things you can do. It can be like education, making a better work environment, nursing legislation and regulation, and also technology research and data collection can help in the areas of restructuring the hospital. So as an education, moving more graduates through the graduate studies more rapidly, identify the range of options available beyond the entry level roles such as faculty research and administration. And you want to make sure that you create and sustain staff development programs and lifelong learning for continual competence. So education is very important. Being updated on the nurse practices, standards, and policies, will also help the nurses. And your work environment also can affect the nurses. So you want to have a positive work environment. You want to be able to let the nurses have a flexible work schedule. Be able to, instead of doing always 12 hours, maybe 8 hours that day or so. Also rewarding experienced nurses for serving as mentors and preceptors to new nurses, because some nurses also feel that in some sense that mentoring and precepting is not for them, or it's just it's thrust upon them, but if you give them the opportunity to be more involved in the mentor preceptor programs within the department, that can also provide positive feedback. And as always, salary is important. Across the board raises, finding options, ways so that one can benefit from their job. So legislation and regulation. Advocating for increasing nursing education, that's important. Legislation like the CNOR, that's one of the things. Have nursing to go back for certifications, helps them take pride into their jobs. There are so many increased public funding resources for education. Like my hospital, they offered us the option, assisting us with our BSN or our master's, tuition reimbursement. Not only that, my hospital also was able to formulate a ADN program with the community college. They work together where the students go to El Centro and they do their course material there and do their clinicals at the hospital. And they, once they get done, the hospital will hire them as nurses, and give them 2 years of experience. And after that, they want to stay, they can stay or they can go. But not only that, you have 2 years of experience. And one thing about it, my hospital is a magnet hospital, so it's very important that you obtain your BSN. So, they will help you get your BSN. Technology is very important to the nursing practice. We have always been told within nursing, taught within nursing to critically think. Evidence-based practice is important to us. And so on. So what have we taken from this PowerPoint presentation? The increase in nursing is very important. So the PowerPoint slide states that over the past decade, the average age of employed RNs have increased by nearly 2 years, from 42.7 years in 2000 to 44.6 years in 2010. So America is seeing a vast increase in the number of people over the age of 65. The age group has many medical and health needs and will put a strain on our healthcare system. Recent reforms in healthcare will give millions of people access to the healthcare system. More nurses and healthcare professionals are needed in response. So we're going to need more nurses to be able to take care of our patients. Thank you.